committee for the is it misuse of drugs, I think? They have come out and said that, they've given a particular level in which it's legal to sell CBD. So they've said 5 micrograms per portion, so that's per, like, I don't know, drop of oil per gummy sweet, per that sort of thing. And prior to this, I think it said less than 0.2% of THC. So it's very varied, and off the back of that, there has been that there is no suggestion as to how that's gonna be quantified as well. So as you can tell, I'm that's very confusing in terms of what the legislation looks like now, and it's still ongoing in terms of what it looks like in the UK. So the objectives of the study, particularly, so we took a population of chronic pain patients, and we had a look at their decision-making process. What kind of led them to want to take CBD? What was it that led them to want to take CBD in general in the management of their chronic pain condition? And that wasn't specifically asking just about pain, but anything. Was it secondary symptoms, so like sleep or anything like that, that they could bring forward? And then we also wanted to see, on the back of that, the benefits and barriers reported by by the participants who engaged with the study. So what they found were the barriers to accessing CBD or taking it, and also if they had taken it, what the barriers were to that. So just I'll pause there for now. So in terms of the population we had looked at, which I'll come on to that in a second. No, I'll come on to that in a minute. And then the last objective was around patients' experience of talking to pain professionals. It's actually more just professionals in general. We weren't as specific as pain professionals, and the participants weren't that specific either. So just more healthcare professionals in general. Um, so we recruited from 2 sites, and they were 12 participants altogether. We did some semi-structured interviews, some of which were online, some of which were face-to-face. So the population that we'd taken on were people who had been diagnosed with a chronic pain condition. So from the Walton Centre was one of the sites, and the other was at Broad Green. And we did so in terms of the recruitment, we'd done it through the registry at the Walton Centre and through some posters. Um, and from Broad Green, we'd done it with just the posters. There was a mix really of people that had come through, and quite a heterogeneous sample really of people with chronic pain um, diagnoses, which I know is what everybody sees in the clinics, etc. But we've taken people who take. We decided we'd have people who had taken and considered taking CBD. So people who had taken it within the past 18 months, and then also people who'd considered taking CBD in the past 18 months too. So that was the spectrum. We didn't necessarily just pluck that out of the air, although it was difficult to consider a timescale really. But in terms of that, it came from studies that had been done in I think it was America, that were quite similar to this. They were more quantitative studies that looked at what would be described as somebody who might be a novice compared to somebody. So they described somebody, a novice, from who'd been taking it for 18 months. So we decided to maybe use that as a bit of guidance, although there was a little guidance around that. So yeah, so that helped us to give a maybe quite a well-rounded perspective rather than just people who are taking it. It was also exploring the barriers as well as the benefits that people might seek from accessing CBD or taking it. And then we analysed it using thematic analysis with a critical realist perspective, which I won't go into too much more detail here as we've not necessarily got the time, but there's a bit of a nod to that in the results as we go through it. Okay, so here's the thematic map. I know it looks a bit of a mess at first sight. In my mind, that looks really, really looks really neat given my mind's state of the data. But I think when I got it down, I suppose it's just showing there the main themes of the circles, the larger circles, and coming off those, some of the sub themes. And as you can see, there's some links between some of these sub themes, and attempted to put some direction in there too. But this might become a little bit more apparent as I go through it. But that was what we ended up with, so the 4 main sub themes and the 4 main themes and the sub themes coming off them. So here was this bit of a table just representing the themes and sub themes that came. So I won't go into every single one, but I'll try and give a nod to each one, and then I'll draw out some of the key discussion points I think would probably be the best way to do it. So one of the main themes that did come up was this sense of access. So participants describing it was really easy to access these products online. Um, and the products and the information, both online, on the high street, from various shops, Holland and Barrett's, that sort of thing. Um, but there was a preference really for that not to have come from that source, and there was this is a sense of this legitimacy of sources of information and products, in that there was a preference for that to have come from healthcare professionals, but that sometimes wasn't happening. And I'll come on to discussions with professionals shortly. In terms of the barriers to accessing CBD, there was very little, other than more these kind of cultural, social perspectives, such as stigma, which this links in on the map. You can see there's a link between these two for that reason. I'll come on to that a little bit more in a little bit. But there was a sense, I think, with access, that access to this was almost reflective of a cultural shift as well, a positive one, in that this was much more acceptable, as well as as a form of maybe alternative treatments. Thinking about views of CBD, again, this also had a real generational cultural shift aligned with it, and these two themes did link quite intrinsically. Um, and there was a sense here around they went through the sense of what perceived benefits there were, what perceived side effects there were. And one of the key things that really came up was this comparing with CBD and other medications, which we'll come on to in a little bit later. Specifically, prescribed medications, what the benefits of taking. They were almost like this sense of weighing up CBD versus prescribed medications, and that's what really came through. Stigma, although views and this cultural and generational shift had happened, there was still this residual stigma related to cannabis. We had, in terms of the population we had, just as a nod to that, in terms of the participants, there was quite a range of ages as well between that. I always forget the name. Sorry, I think it's 18. I think the youngest was 18 or was it 20? Maybe 20s, in like early 20s, I think, through to like mid 70s. So there was a real spread of ages here, and all that came through in almost all the participants. This sense of a generational cultural shift. Coming on to this discussions with professionals, there was quite a mix actually. So some people did describe there to be they did describe quite a positive reaction, quite an open and honest discussion with individuals, and in some cases, however, in other cases, they found that the responses from professionals were also maybe quite non-committal, often feeding into this feeling of being quite invalidated, whilst they were seeking other ways of managing their chronic pain condition. However, they did reflect on this and said that actually, do healthcare professionals have time to talk about alternative medications? So they thought about this in the context of systems that we're in. So thinking about actually and actually considering themselves to be a burden if they were to bring that up. So that wasn't necessarily just from just from the professional's perspective, or necessarily just that dyadic relationship. It was actually in the context of the systems that they're in. And one key mediating factor between that was trust. And I'll come on to that a little bit, between what they considered to be positive and negative, and actually being able to talk about it was the sense of trusting a professional. But I'll come on to that in a little bit as well. And lastly was kind of taking control. They found that it was a bit of a trial and error, but they also found that through their journeys of chronic pain and seeking out various ways of managing their chronic pain, they often found themselves having to advocate for themselves in interactions with healthcare professionals, and just in general, really, I suppose, in interactions outside of these systems, that where they are having to maybe kind of champion themselves and the choices they're making, and even if they have to do that outside of a clinical setting, that's what they were kind of saying they were doing. But there was still maybe a sense of linking a little bit back to this access of information and products, was that they still feel that sometimes they would feel much more comfortable if it was supervised by a healthcare professional, um, in an ideal world. So in terms of those discussion points, I suppose I'm thinking here just about, I know I've spoken a bit more detail than I was planning on doing, but I think just thinking about those discussion points that came out in the study was this sense of patients' medication beliefs really influence this sense of decision making, this weighing up between kind of necessity and concern. And in some ways, what came from that was they didn't they weren't passive. They would take the information in terms of medication beliefs. They take the information around medication, almost like process that themselves, influenced by various, factors, social, internal, all of those kind of things, whereby those medication beliefs were quite a pivotal point in that people were saying that, they would weigh up dependence and long-term side effects of these medications over a period of time and come to a conclusion whether that's something they would want to take. And I suppose what really came from that was, what do patients really want from their medication? Really, that's what came through that as a general theme. What do they really want from it? Um, and I think this links in quite intrinsically with this comparison with prescribed medication. So a lot of people made comparisons with prescribed medications. They didn't say specific medications, but more to do with nothing specific came through as like a theme, like opioid or anti-convulsants or anything like that. It was more to do with prescribed medications and the side effects they produce having a profound impact on their functioning. And actually, when they were talking about the decision-making process, it was less about the analgesic effect and more about the functioning. So would this thing that I'm taking, medication prescribed or alternative that I can get from a shop, is this going to increase my functioning rather than is it going to reduce my pain? And I think that seems to come through quite a lot with their comparison between CBD, in that even though some people described having some benefit around some analgesic effects, but actually they said that actually replacing my prescribed medication with CBD actually allowed me to function a lot more. Whether that says more about CBD or more about prescribed medication, that's probably to be drilled into a little bit more. But I feel like that was a really key theme and maybe a really key discussion point for this. Um, that patient clinician relationship really came up quite a lot for a lot of people, especially around obviously discussing with professionals that key relationship with the professional they were talking about trust, as I mentioned before. That played a huge part in having these open, honest discussions with people saying, I take CBD. Some people holding back for various reasons. um but and there was that sense of maybe having quite non-committal answers from um professionals and healthcare professionals, often leaving them feeling really unsure where they sat with it, whether they could talk about it, whether they could take it, in line with their other regimen of medications and interventions. There was also this influence of social and cultural factors, and I suppose I'm just giving a nod here to the critical realist perspective that tries to bring in the context really of these mechanisms that might be involved in this potential phenomena of taking CBD and that increased of taking cannabis-based medicines for chronic pain. And I suppose in this context, there was a sense of um, there was less in my mind. I thought there'd be more around potential desperation, but I didn't necessarily come across that way. But I think in terms of the social and cultural factors, there seemed to be a lot more about this shift towards it being more acceptable. It's much more it's ubiquitous. It's pretty much, when I say everywhere, I mean that in terms of if you were looking for it, you could find it very easily on the internet, on the high street. Um, and one key thing that came out of the social factors was this sense of felt stigma. So not necessarily actual stigma. Sometimes they may have experienced that with interactions with family or um, other systems, healthcare professionals, etc. But I think there was a sense that there was more of a sense of felt stigma, so not actually having to have actually experienced criticism or judgment as a group of people taking CBD or cannabis-based medicines, but there was a sense of this felt stigma that people might experience, and that really reflected other research that had been done in other countries too. And there was a sense here of this conflicting between this cultural and social shift and healthcare views of it. So there seemed to be this real conflicting sense that in one way I'm being told by media, by these sources of information, I can access it. It's fine. It's okay. But with the non-committal responses and potential um, feelings of there not having much information on a more official healthcare professional level, there was a sense that I feel quite conflicted between this, but I'd really like that discussion to happen with a healthcare professional in order for me to really weigh up this. uh, these products. And lastly, there was a bit of a shift as well that was noticed in that people were maybe a shift away from this sense of powerlessness that people might have felt when they were when they were accessing intervention chronic pain interventions, in that maybe taking about a little bit more control or a sense of more internal locus of control where they felt they had that within themselves to go and access this, whereas before there may be barriers to that, or potential hoops to jump through, and they felt, and there was a sense of taking a bit more of an active role in their pain management as well. So, what would be the clinical implications, really, I suppose, of some of these findings? So, the implications, I mean, first off, I think there was a real sense here in terms of the decision-making process, the importance of the patient-clinician relationship. Now, I know you guys are probably really fully aware of building that relationship. That relationship has probably been influenced by many interactions, clinical interactions prior to getting to any sort of specialist pain management program or a pain management center, or tertiary or secondary center. And I suppose what people tend to may carry with them is that sense of stigma, that sense of mistrust. And I'm wondering whether, just in decision making in general, not just about CBD, I suppose I'm talking here about in general, it's important to maybe keep in mind that sense of trust and building that trust with those individuals in order to start to move on. That might be quite explicit for us, but I'm wondering whether for other professionals it's also maybe quite helpful to understand that too. I think there was a real sense here that increasing healthcare professionals' understanding of CBD is probably maybe quite im- important to help in that facilitation of those discussions and those open discussions, open and honest discussions um, uh, with patients. I'd be really interested to hear what people's experiences are of that actually, in terms of what that feels like having those discussions. I got a sense this is really quite a small number of people that maybe I've spoken to, but maybe that really uncomfortability of talking about it. And I wonder whether just a bit more understanding that might come from more research as well, which I'll come on to in a little bit. But yeah, I wonder whether just being informed by that research would be really important. A bit of chicken and egg, I suppose. And then bringing into this sense of this wider social and cultural context, and bringing into awareness this shift that's happened potentially, where there might be a little bit of a misalignment with where healthcare is coming up to with what culturally is now slightly more acceptable, or what might be considered as taking safer medications. This is something that's might be considered. This is just maybe something to think about. I suppose this is also linked with the research as well, isn't it? I suppose, but being aware of what these cultural shifts might look like, and when the people that come in for various assessments or pain management program or any form of intervention, I suppose it's thinking about the context that they might come from and where those views might differ from maybe what might be perceived by healthcare's views of something. I'm being quite vague there, aren't I? Sorry. Please ask me about that afterwards if you feel like that was a bit too vague. And then the clinician's role in reducing stigma as well. So I wonder whether gaining that better understanding and having those open and honest discussions gets a really good understanding of what people are trying to do to manage that chronic pain condition, and actually wider than what they can access from the NHS or healthcare systems. What are people going to that they find is actually really helpful for them in reducing side effects or increasing quality of life or increasing functioning? Maybe having those discussions gets a really wider picture and gives a good sense of what the patient's needs are. And thinking about future research as well, I'm aware of time. Sorry, I don't want to go on too much longer. So thinking about consolidation, I think it would be really helpful to have a consolidation of CBD and chronic pain research, CBD specifically, because I feel like when we look at the guidance, as I said, in terms of the NICE guidance and things like that, there's so many varieties of cannabis-based medicines that are being used that seem to cloud CBD specifically. So there's a lot of combinations of THC and CBD. Um, I'm going to say nabiximols, but I'm just saying that because I think I've read it somewhere. But your people will probably know a lot more than me from a medical background on those. But they're used, and then it doesn't. It seems like it's quite clouded. But I do know from the research as well. Maybe there is. It's quite difficult to isolate CBD as well, by the sounds of it. And also thinking about that in terms of the population that I've spoken to too, it's quite difficult to understand what they're taking, given the guidance and legislation is quite limited on that in the country. So the impact of CPD as well. So they did talk about secondary symptoms, so like sleep and mood, but that really didn't come up as a theme. But I would be quite interested to understand if there are more specific, symptoms that people might be using CBD for. That was just naturally, it didn't go that way with the participants. There was no specific question around that. We tried to keep it quite explorative, so maybe that would be something to consider in the future. Maybe something slightly more quantitative. It's not my bag, but I know that other people might be slightly more inclined this way. But thinking about characteristics of people, so I'm thinking here about what other pain options or interventions have they sought out or engaged with before. What leads somebody to potentially, what does that profile look like really about taking CBD or any alternatives, I suppose. And then this is something that kind of came up. I know I didn't talk about something specifically around medications that came up, but in terms of research, there is research conflicting, but some in terms of saying that there may be some opioid reducing effects of using cannabis-based medicines. Now, this is really in its infancy. I don't know. This is just maybe for future research to consider. Is there something here that could be used to reduce that reliance? I don't know what the picture looks like for cannabis-based medicines and CBD itself. That it's quite slim and quite thin on the ground, but could there be more to build up that and have a look at that? Was there something here that could be useful in the future? And then there's my systematic review. I won't go into it. Here it is. Maybe I'll come back and talk about this another time. Just mindful of time now, but yeah, feast your eyes on that for a second, if you like. Yeah. I could talk about that another time, can't I? And that's just a summary of that. But any questions or reflections or experiences are welcome too. But yeah, thanks for listening.
Thank you, Callum. That's
No
really
worries.
interesting. And yeah, just really great to see all your hard work and some interesting findings. So I'll open the floor then. Has anyone got any questions for Callum?
Yeah.
Oh, you've got a round of applause off
Oh,
Shirley.
lovely.
Yeah,
Yeah.
yeah.
Thank you.
Sometimes on a Friday afternoon, you find that it's nothing to do with your presentation. It's just some of us, our brains don't work as well, and we can't think of a question.
Yeah, don't worry, it's all right.
Sometimes, so
Yeah,
that
yeah.
sometimes happens. Yeah,
I'm happy for questions. I'm also happy for none.
yeah.
No, I'm only joking. No, I'm happy
Um,
either way.
while everyone else
Not
is
put
maybe
anybody
having
off.
a think about their questions, I was just wondering, Callum, just from you, but you were the person that obviously interviewed everyone for that study, and given that you have sat on the other side, as being a clinician in a pain service, hearing them talk about their experiences of using this stuff, did you get a sense that it was working for them or a worthwhile endeavour?
I feel like, yeah, do you know, I feel like for people it really was. For some people, they were really, really married to it. They really, really like I feel like if they were put in some sort of sales position, they would like that. I think they were selling it to me and I haven't even got chronic pain. But I feel like I was like, God, yeah, that sounds really, really helpful. And some people saying they couldn't live without it. Not from addictive perspective, but then I don't know whether there was a reliance perspective. Some people did talk about reliance a little bit, saying, if I took it away, would I feel some withdrawals? But I'm not really at the position. And some people who had taken it, stopped taking it, and were considering taking it again, or had started taking it again. I feel like, everybody that I spoke to, I'm also quite aware that they might be quite biased because they come forward to talk about a, a CBD study. Um, that that it was quite overwhelmingly positive, and the effects that it had, I thought people would say it's not overly that great. But then there were some people as well on this flip side of that said, to be honest, it was all right, but I'm not sure it really affected me too much. It wasn't like that hit of taking something and I feel like it's got it taken it away. But yeah, I feel like, yeah, to be fair, it seemed very positive from what they were saying. I think it's also quite difficult to determine what people were taking as well, which is a little bit difficult given the state of legislation and people getting off the internet, not really sure what they're taking. But yeah, I feel like the general gist of it is that it was positive, even if the effects were minimal.
Mm.
Yeah.
That's interesting. Just because
Mm,
I don't hear it get reported much in clinic myself, and
right. Mm,
there may well be a bias there of the types of people we're seeing by the time they come through to PMP assessment,
mm,
or it could be like you've been talking about in your thesis, that it's not something they would think to bring up because of that stigma. So I don't really
mm,
get a sense of, how well does it help people that do take it. So
yeah.
no, that's interesting.
Mm,
So the lovely Alex has a question for you. So you'd like to take the floor?
Thanks, Katie. Thank you, Callum. That was really interesting, and I remember being and listening to your talk, your proposal
oh yeah.
last year. So it's nice to kind of see this in live now.
Mm,
Sort of a reflection, sort of a question. So you obviously had a bit of a think there about, is there a bias about the people that have come forward for your interviews?
mhm,
And I feel like I've noticed actually quite a lot recently in my clinical assessments in the past few weeks, if not months, more people talking about their cannabis use and being very positive of the effects in terms of
mm,
both, oh, it's helping with my mood, it's helping with my sleep, it's helping with my pain, but also it's allowing me to not rely on pain meds, opioids. And so that was explicit, and that wasn't invited by me actually, which I thought was
mm,
quite interesting. Um, but they were kind of anecdotally saying that they felt it helped them to reduce their opioid use or any other kind of pain relief. What I was wondering is, I actually, as you're talking there, I don't know what it is that they are using. So, is it that they're smoking weed? Is it that they're using the CBD oil? And I'm thinking, should I be asking? Is that something that I need to be, I don't know, clearer on? Is it my role? I
mm,
don't know. Maybe that's one of the questions that maybe what healthcare professionals don't talk about it, because yeah, is it relevant in their role? But actually, well, which one is it that you're using? Obviously, we want to be aware that if
mm,
someone's using or smoking weed, for example, that they are not high when they come to sessions and they're able to actually engage in group and things like that. And I
mm,
feel a bit ignorant sometimes, thinking, how is that going to impact you? Because I don't really fully understand what it is that you're having. And some people talk about it like I should know, like pill, like what something someone described. I don't know if it might have been when I was on assessment with Louise. I don't know if Louise remembers the young adult talking about these pills, but it was like a mushroom or a pill. I was very confused by that.
right. Yeah.
Um, so yeah, I feel like there's lots out there that I don't know, and I don't really know
Mm.
what should I be looking out for.
I think quite interestingly, actually, I feel like you're touching on quite a few things in that, like generationally. I think it's interesting that you said young adults, because there's a lot
Yeah.
about I'm really bad with like these. They're so many, they're so complicated, aren't they? Can't just be simple. But like, is it like the like mushrooms? Is it what's it called? No, I can't remember, but something around that, around depression. So there's a lot of like things now that potentially have been used in the past recreationally. There's a lot more medical consideration to them, like ketamine, slightly more. I know not all the time. I'm not saying it's used routinely, but like things like ketamine, things like that mushroom thing, things like cannabis related medicines. There seems to be like a cultural shift in that people are saying, even medically as well, why aren't we re-examining these avenues? And I wonder
Yeah.
whether that's being picked up generationally too. And they're saying, actually, socially, we actually don't mind taking these things, because if they can give us this less side effects and don't, less side effects that increase our functioning or quality of life, maybe that's what we prefer. But why aren't we seeing it almost? And I wonder
Mm.
whether people are then being led to search for these things independently. And I think you're quite right. People that, when I spoke, I think I reflected about this like afterwards. I probably should have thought about this during, really, but when they were talking about, oh, I take CBD, like where they get it from, actually, given the legislation and guidance and regulation of this is very limited, I actually don't even know what they're taking. So they could be taking something that's actually illegal to consume, but maybe they don't even know. And then when we're talking about like CBD, a lot of people were like, I'm not really sure what it is, but we take it because is it
Mm.
is it Claudia Winkleman? Isn't she like on a isn't she on an advert for it at the moment? Like, oh, but like, do they actually know? And I think given that legislation has literally only just come out on, was it like Tuesday or something, about, oh, it should have 5 micrograms per portion or per serving, I think that says a lot, given that a lot of people are taking it. But no, I agree. And then I think it comes on to, so in the study as well, we said about taking illicit drugs, that they shouldn't be taking illicit drugs. That was kind of an exclusion criteria. But then again, it's self-reported, isn't it? And what do they know what they're taking, whether it's illicit or not? I mean, they've bought it off the internet, they got it off their friend. One really good thing, something that came out of it, I wish I could have put it in the title. Like people are dead clever and they put like a quote into their title. I wish I could have done this, but they said it's the difference between a dealer and a doctor. They said like they would much prefer it from a doctor, whereas if they get it off somebody, they said like, if I get it off somebody running off a street corner, or Hollands and Barrett's is all right, but I'd much prefer to get it from a doctor, because that's the difference between getting it from somebody who's dealing or somebody who is legit, really. So yeah, I think it's quite interesting. I think you touched upon quite a lot there, and it's interesting that you get that in your clinic, or at least those those thoughts coming through when people are bringing it.
And also in grief, it wasn't just young adults either, although there was young adults were saying things that I felt like I was beyond me.
Yeah.
Not had any of these things before. But middle-aged to older adults, and actually one person in group recently was very anti-medications in general, and what they do to your body, but was very pro cannabis, and it was interesting. So yeah, thank you.
Thank you.
Lovely. John, you got a question?
So yeah, kind of linked to that really is that I just wondered whether there was any negative impacts of this, like whether people reported any problems with taking these kind of things, because we tend to associate cannabis, certainly, don't we, with maybe mental health difficulties or functional problems, but then I guess, I suppose, if you not entirely sure what people are taking, then I'm do these different things, like obviously there's CBD, but there's also THC, and whether it'd be interesting to know what the difference is between these in terms of the effects, the impact, and how it impacts on, like you say, whether it's pain or secondary symptoms related to pain.
Yeah, I think that there's in terms of like the ones that are prescribed, I know that they have varying degrees of like potencies in terms of THC and ratios between THC and CBD. I couldn't tell you what they are, but I know that they tend to vary. I'd be interested to know what the outcomes of those are on people who might be taking them long term. I know that they do it really sparingly though in any of those three diagnoses that I mentioned, which I really struggle to get struggle to get out earlier, but so I won't attempt again. But yeah, no, I know what you mean. And I think like, so when we spoke specifically about side effects, pretty much every single person said no. They just said, and some people were taking it for. I know we can't. It's difficult to know, isn't it? Because it's not controlled. We also can't prize apart what is prescribed medication, what is CBD, what's being used. That was also something that came up in the literature. So what are we identifying here? Is it? So that's why we try to minimize that in terms of people not having changed their prescribed medicines in the past 6 months prior to the interview. But I think it's difficult to know, because you can't prize apart these drug effects or interactions, and whether they, maybe they had a good day, or maybe they also antidepressants as well. If it's going to affect their mood, are they changing medications there? Or it's hard to know, isn't it? But in terms of side effects, when we asked that outright, everybody said that was probably often tends to be like no. And I was like, is there anything? No. So I was like, right, okay, next question. That's the one that just felt kind of like dead in the water. They were like, I don't see. Even people who said I didn't get anything from it, who weren't overly that positive about it, they said, well, no, not really. There was like perceived, they said potentially they were worried about long-term side effects, but the short-term ones, given that they'd taken it, for people who'd only taken it for a period of time, there was the long-term effects were like worries about withdrawals or reliance, and that tended to be linked to, but that's what cannabis produces as a an illicit drug. So would that happen with CBD? So there tended to be this perceived, but not not a lived experience of that by the sounds of it. But yeah, it's hard to know.
The other thing I just wanted to kind of comment really is that when you were talking about the NICE guidelines, that's interesting, because I always felt like with the pain management stuff, they kind of took a pain management program and lumped that all together. But when you look at a breakdown of within those studies, what constituted the pain management program was so variable. So if they've done the same with this, like, cannabis-based medication could be like a massive variety of different things.
Yeah.
It just kind of highlights the need for looking into this a bit more, doesn't it?
Yeah, you're right. And that my systematic review was on pain management programs. When I agree, when I looked at it, I was like, what? How have you gleaned this? And that is a little bit like the guidance with this as well. You're quite right. It's just I looked at the specific studies and they're so varied. There is one that's specifically CBD. I know this guidance isn't about CBD specifically, but it's so varied that then they say, oh, we can't be sure. Well, of course you can't be sure because like you haven't used the same intervention. So it's how they've gleaned guidance from that. It's just an interesting, isn't it, when you look at it a little deeper and you think, oh, and you take the time to look at it. Not a lot of people have the time to look at it, do they? But given that I was given plenty of time to read it, that was yeah, it was just interesting when you look a bit deeper at it. Absolutely, yeah. Thanks, John.
Okay, Sharon, you got a question?
Yeah, I just wanted to comment because I've noticed with groups of patients, the patients group that seems to mention this a lot more that are on CBD are the CRPS patients.
Right, okay.
Because they found that other medications don't work for them.
Right.
They have a lot more support groups of people with this condition. And there's a lot of excited chatter and has been for many years about CBD, you know, is it useful? Is it giving me pain relief or is it just helping me cope better, feel less anxious, improving my sleep so it's worth it? And lots of patients have volunteered said if there's any research into it, if that's the only way I'm going to get it prescribed, my hand is right up. And lots of these patients say this. And I have noticed it's a lot more readily available in like chemists, so it seems more legitimate than it was not that many years ago. So it's like, oh well, the pharmacist advice will advertise that I can have it, then I'm thinking like this is proper medication now, so I will take it.
Yeah.
It's just a difference in a few years of how it's been accepted.
Yeah, I think you're spot on. I think that cultural shift has been really rapid. And I think there's been this sense that it's okay. And they will talk about these legitimate sources, like talk about dealing with a doctor. I know that's extreme, but there seems to be this sense that, well, I can get it from Holland and Barrett's. And Holland and Barrett's is quite, you know, a well-known company. So surely they wouldn't sell me anything that was bad for me or I'd get addicted to. And like you say, you can get it from a chemist, you can get it from lots of different places now, like specific CBD shops. Do you know what I mean? There's an actual shop specifically for CBD products. So there must be enough variety of products for this to fill a shelf of like, or multiple shelves of it. But it's interesting that you said that specifically you found it more with CRPS because in terms of evidence, it's great, you know, from a clinical perspective, because in a research perspective, there hasn't really been much to say that specific groups of people will take it. Or so it would be really good, like if there was a specific group of people that you could talk to, you know, or that's where I was thinking more of a quantitative study would be quite helpful to consider that perhaps in the future. But and I think also you're picking up on the sense of people's journey that they've been through. This came through quite a lot. I feel like this comes through quite a lot in a lot of the pain research, both in the systematic review and like empirical and just in general. The sense that they go on a journey and it's often not linear and it's very complicated, maybe quite emotional, maybe quite socially stigmatizing, not only by professionals but wider groups, you know. So I wonder what like that whole journey leading them to maybe make a choice around this, around something that will just allow them to, well, why would I access a service that can't help me, like you were saying, or you know, and this taking in consideration somebody's journey I think is really important when it comes to that decision making process. Because actually I don't know, I tried to get length of, we couldn't report because I didn't get the ethical nod to say like the length, like duration of pain. I know that doesn't necessarily suggest that, but maybe duration of pain then suggests that they've probably been batted back and forth potentially, you know, between services. But it'd be interesting to see that, and I think that's where maybe some of those quantitative things could really shed some light on that, you know, like what is that profile or the characteristics that really leads somebody to want to take something alternative like that. But it's really interesting that you found that CRPS particularly, because I imagine as a group of like a subgroup of chronic pain patients are probably quite maybe quite stigmatized or often fall into that of like medically unexplained symptom, you know. But yeah, thanks, Sharon. That's really helpful. Cheers.
Lovely. You've prompted some interesting discussion there, Callum. Has anyone else got any questions at all? No, I think we've covered everything. So I've probably got loads of questions, but I could go on for ages. So I'll shut up now and we can crack on with our afternoon. So a big thank you again, Callum, for all your hard work and for exploring a part of the pain world that we didn't know much about. It's quite a novel study when you think about it. You know, you really did add to the gap in the literature there, and it's got those lovely clinical implications and food for thought for us as well. So that's lovely. So thank you again. So keep in touch with us and all the best in your new job as a fully fledged qualified. They're very lucky to have you. Yeah, we may think about you coming back for the systematic review, but again, don't worry, you know, like I said, 3 REMS is quite a lot. So yeah, don't worry about that. Lovely. And thank you everyone for joining. So everyone. We will see you again soon. So have good weekends, everyone.
Have a good one.
Thanks,
see you
Callum.
guys. Thank you. Cheers.
Bye.
Bye-bye.
Thank you. Bye.
Bye.
Bye, everyone. Nice to see you all.
And you. Bye.